Welcome back. You're listening to Dr. Margaret Ames and Your Dental Health. I'm talking about minimally invasive biomimetic dentistry and how that can happen for you, and how you can save thousands of dollars over the lifetime of each tooth. If 20th century dentistry was so great, we wouldn't have root canals, implants, or crowns. So I mentioned before the break that I was going to tell you about a wonderful, wonderful cardiologist. One of my hobbies being a healthcare person is to try to get people to be healthier, my own health, my family's health. But in doing some of this research, I found information as clear as the research about biomimetic dentistry. It's nutritionally preventing and reversing heart disease. I met a great lecturer, Dr. Robert Ostfeld. Dr. Ostfeld is a cardiologist, and he's the founder and director of the Cardiac Wellness Program at Montefiore Medical Center in New York City. He earned his MD from Yale and his Master of Science in Epidemiology from Harvard. He works with patients to help them embrace a healthy heart lifestyle. His presentation is over the top. It's compelling. I dragged my husband there because I wanted him to hear it firsthand, and my husband was at the edge of his seat just going like, wow, this is great stuff, like don't interrupt me. So I asked Dr. Ostfeld if he would come and talk on Long Island, and he agreed to if I could get him a certain number of patients, and he doesn't have any honorarium. He does not get paid for this. He does it out of the goodness of his heart, out of his passion about the effect of diet change to prevent heart disease. He's fun to listen to. He presents a logical approach in explaining the process of heart disease, present treatment modalities, and how science has proven that heart disease can be reversed. And I got a venue for him to come. So please go to my website, www.drames.com, and you can see, you can send me a message that says, I want to register for your program. You can call my office at 631. Oh, I'm not going to give the number. I think I better, though, for Dr. Ostfeld's visit on Thursday, September 11th at 7 p.m. at the Unity Church of Healing Light at 203 East Pulaski Road, off Park Avenue in Huntington Station. We're just asking for a $10 donation to make a donation to the Cardiac Wellness Center, as well as to make a donation to the Unity Church of Healing Light for allowing us to meet there in their beautiful facility. So I look forward to seeing you. I will tell you again in the future because he is, it's a great talk, and it'll probably be sold out. So back to biomimetic dentistry. The advantages of these engineered restorations, engineered like not just fill the potholes, are that precious tooth structure is saved and there's minimal trauma to the nerve and the blood supply. And as the tooth absorbs the forces of your bite load with a minimally invasive restoration, the forces are dissipated. They don't earthquake the tooth. When a conventional crown is used and the tooth is overloaded, forces disperse to areas below the crown, like down the root. And if the overload is too far or in a bad direction, the catastrophic failure generally is below the crown and often leads to loss of your tooth. Consequently, more drastic measures such as root canal or extraction and a partial denture. How would you like to have a removable denture in your mouth? If you do, you can't look back. That's what you have now. But I always encourage young people who have a great set of teeth to care for them. Learn how to take better care of them. That's what we do in our office. My hygienist, we're all coaches. If a patient goes in for a filling, a restoration, I will stop and say, look, you're leaving a little plaque here. Let me show you how to reach that. So anyway, the tooth was prepared for bonding. When I bond the tooth, it's prepared with a stream of aluminum oxide that I spray onto the tooth, and it's a whoosh. It's not that drill sound that David played a little bit earlier. So let me tell you a little bit more about the flexing of a tooth. People think, teeth flex? Aren't they like stones? They're really not. Some of you might have these little notches up at the gum line. It's usually right behind the front teeth, and people put their fingernails up there, and they say, I feel this little notch here, and it hurts. And whenever I go to the hygienist, she can't clean that part, or I have to have Novocaine to get a cleaning because it hurts so much. These used to be called, dentists would say, oh, you've been brushing too hard. You've been brushing your teeth too hard. You have to stop brushing that hard. That's not what it is. It's not what it is at all. It's because the patient has, the teeth don't fit together. The gears don't mesh like they're supposed to. So when the patient grinds their teeth, we do that in our sleep. We clench and we push on the teeth. They break off pieces of tooth. And then when they brush their teeth, they wear it out faster because they break off the enamel down at the gum line or up at the gum line on the upper teeth, and they brush their teeth, and the dentin, which is exposed, is 7 times softer than the enamel. That's really sad when you see like a tooth that looks like it's a tree being chopped down. So one of the things that I do to dissipate the forces, or to not have the forces go that way anymore, is to move the teeth with Invisalign. Invisalign is fantastic. It's easy to use for the consumer. Every patient that I've done has been so, like, when it's over, they go, that really didn't take that long. I love my teeth. It's so exciting. So the notches at the gum line are so caused by such force of clenching that we don't want that to happen anymore. So when I put in a restoration, because even though there's no decay there, you have to put something into that area so that the patient doesn't brush it away. And I want to make sure that it lasts. So some people need to have their teeth straightened out, which they're really happy about anyway, because things that look good generally function better. Form follows function. So those people with nice broad dental arches, like I think maybe Marie Osmond comes to mind for some people of that age, nice broad smiles, those are healthy. That's a healthy alignment of teeth. You don't want to fatigue the bonds of the tooth. Let me take a little aside here and tell you about what we dentists are faced with all the time. It makes it very hard to move forward if a dentist is relying on those dental journals that come for free. They come into the office and you pile them up and you read them once in a while. And they're really not the ones that are referee journals. They're really not based on the sound scientific research most of the time. As a matter of fact, I read How to Treat One of These Notches at the Gum Line from the same author. I don't want to say his name because he's pretty well known, and I really do have a lot of respect for him. But in 2 different of those throwaway journals, he had 2 entirely different ways of restoring those notches. And that's when I came to the realization, like, wow, I can't count on these. I can't count on this. I have to find real science in real journals and get stuff that's backed by research that's been done for years. So, by the way, if you just tuned in, you're listening to Dr. Margaret Ames with Your Dental Health. I've been practicing dentistry in Huntington, New York for the past more than 20 years. And you can reach me in my office at 631. No, I'm not going to tell you. You can go to my website at www.drames.com. Search my website. Somebody found me recently from Brooklyn. I had him on the show last week. And he said, he gave me a review that my website really did get him to take 2 subways and at Long Island Railroad to come out to see me. And his wife is coming in next week. So it's pretty exciting. Something else I want to tell you about is if you really want to know what goes on in my office, you can call between 12 and 2. You can call John Gomez, the John Gomez Show. I would think that you might want to call him on Friday because he has TGIG. Thank God it's Gomez. And he has kind of like an open line on Friday. So call up and say, hey, John, what's it really like in Dr. Ames's office? And he'll tell you. He didn't tell me it was okay to do this, but I think he'd like the phone call. So anyway, I wanted to tell you about another celebrity. Many of you have heard of Carol Alt, the supermodel. And she has a health show on Fox News Radio. And she has covered many issues. And I've been watching her show a little bit, and she's not out to sell you anything. She's not out to say, do it this way or that way, or to promote a product. She really wants people to be healthier. So she told me through her Twitter that she follows me, I follow her, that she is going to have a dental show on in August. And I'm interested to find out what it is that she has. I said, is it biomimetic dentistry? And she said, let me ask the dentist. She came back to me a day later and said, well, it's close. Well, close only counts in horseshoes and hand grenades. That's a bit of a cliche. But you might want to look at Carol Alt's show. It's on at Saturday at 4 p.m. on Fox News Channel, and she has different health issues every week. So what else would you like to know? Creating restorations, back to my initial opening segment, that have fail-safe zones built into them, protects a tooth from catastrophic failure. You're not going to have a test on this, but I like to review. So if you want minimally invasive, less amputational, almost no root canals if you don't have any pain, you need to see me. you need to look at my website, www.drames.com, drames.com. Come into my office. Looking forward to seeing you. Thanks for your attention, and we'll talk to you next week.
Whenever I see your smiling face, I have to smile myself because I love you. Yes, I do. And when you give me that pretty little pout, it turns me inside out. There's something about you, baby.